Well, hello everyone, and welcome to another episode here on RN FM Radio on the Pulse of Nursing. This is the leading platform for nurses, and we're thrilled to have you tune in for the latest news, trends, and hot topics with the leaders and thought-provokers in our industry. We're coming to you live right now. This is Monday, October 7th, 2013, and we're hanging out at episode 83. Welcome again. I'm Kevin Ross. I'm here in my studio in Colorado, fresh off the plane from Orlando, Florida, from the National Nurses and Business Association Conference, which totally rocked, and we'll tell you more about that. And, of course, my fellow co-host, too, has stepped off the plane just moments ago, and he's coming to you, actually, no, not live from the airport, but he's actually hanging out in his studio in Santa Fe, New Mexico. Keith, how are you, sir?
Hey, Kevin. Well, I just rolled into the house just about, 45 minutes ago. My wife and I did have time to stop for dinner in Santa Fe, luckily, at our favorite neighborhood restaurant, the Tune Up Cafe. And it is really amazing to already be back here in Mountain Time after being in Florida for 4 days. We will tell you all a little bit about the NNBA later this evening after our interview with our wonderful guest, and then we'll tell you about a little show we're going to do on Wednesday afternoon to really wrap up and debrief from the NNBA in toto. So welcome, everyone, to episode 83. And, Kevin, I'm going to let you do the little intro of how to find us and stay in touch, and then we'll move on to our wonderful guest.
Well, that sounds fantastic, Keith. And, of course, to all of our listeners out there, if you haven't found us yet, like I've said before, where in the heck have you been? Get over to rnfmradio.com because you can find all of our shows live right there or archived. And there is a Listen Now button on rnfmradio.com, and you can find all of those shows over there. We're also hanging out on iTunes. All of our archived podcasts are over there as well under the search RNFM Radio, no spaces, no dots, or anything like that. We, of course, are also archived on ProMed Network at promednetwork.com/RNFM Radio. Now, for all of you new NNBA social media savvy nurses out there who know what's what when it comes to hashtags, because of myself, Keith Carlson, and always the nurse-friendly nurse-up, Andrew Lopez, we're hanging out under the hashtag RNFM Radio. So anything that you want to shout out to us while you're hanging out on Twitter under that hashtag RNFM Radio, please do so, and we'd love to bring it on the air. Now, of course, you can call us at 720-466-3022. And when I say call us, you can just leave us a voicemail or you can text us. We would certainly love to hear from you. Now, of course, our studio call-in number is 347-308-8064. And, of course, we will be letting you know that number throughout the show, just in case you're interested in coming on, and just you can call that number just to listen, but we'd also love to have you have, questions or comments. We certainly appreciate it. Oh, and I did want to let the listeners out there know, because we've done so much video at the NNBA, I just feel like RNFM Radio, we've got our new YouTube channel out there. We'll tweet that out momentarily. I'm actually recording this. It's just me in the studio right now, but all of the audio will be synced up, so I'm recording this whole show on video, and then I'll get it all rendered and taken care of and uploaded to the YouTube channel momentarily, and you can actually watch me in the studio but still listen to the entire show. And as always, we'll give you a roundup of the upcoming guests at the end of the show, and again, tell you how rock and roll the NNBA 2013 was. So anyway, I'm going to pass the mic back to Keith, and I'll let him have it and introduce our amazing guest this evening.
Thanks, Kevin. And I just want to give a shout-out, Andrew Lopez, Nurse Friendly, who we met in the flesh for the first time this weekend at the NNBA. He is already on the tweet chat this evening. Hello, Andrew. And Renee Thompson is in Detroit, but it looks like she might be joining us. We're not sure, but she may actually be around on the tweet chat. So if you want to find them, hashtag RNFM Radio, you'll find Andrew and maybe even Renee and other folks out there. Anyway, on to our esteemed guest. Karen Ingalls, the author of Outshine, an Ovarian Cancer Memoir, is a retired registered nurse with a master's degree in human development. She did a double major while pursuing her master's degree, psychology and human development. Her nursing career includes hospice, epilepsy treatment, chronic pain, and her own nursing service for 20 years, which was called Kare N Touch, support where she provided counseling, biofeedback, stress management, therapeutic massage, and therapeutic touch on a sliding scale fee basis. She is a 5-year survivor of ovarian cancer, and she is now dedicated to spreading the word about this lesser-known disease. She has an award-winning published book, as I mentioned, Outshine, an Ovarian Cancer Memoir, which we'll be talking about tonight and giving away a free copy later in the broadcast. And the proceeds from the sale of the book go to ovarian cancer research. And I have to say, my wife and I both cried while reading this beautiful and short and concise and incredibly loving and spiritual book. So Karen Ingalls, it is such a pleasure and an honor to welcome you to RNFM Radio.
Well, thank you very much, and I'm very, very happy to be here, and I thank you and Kevin for inviting me to be a part of this show. Thank you so much.
The pleasure is all ours, Karen. So, anyway, just to kind of kick things off, I guess Keith, of course, talked about your biography, and we know a little bit about what, or who you are, rather. And I guess, if you want, why don't we just start heading into, I guess, a short story, a version of your story, and talk about the Outshine and, of course, your ovarian cancer memoir, and kind of break that down a little bit for our audience. So I think what we'll do is we'll just kind of take it wherever you need to go here and start it off.
Okay. All right. Well, very good. My experience with ovarian cancer prior to my diagnosis was 2 hospice patients who I helped them, through their final days, and then a woman who came to see me for massage therapy. So those were the only 3 experiences I had with ovarian cancer. In about February of 2008, I started getting a little bit of a tummy, a little bloating, which, if you saw me, I've always been on the thin side and have never been on a diet in my life. And so this was unusual, but, I figured I'm 68 years old, so it's got to be just some postmenopausal stuff going on. And I just exercised a little more and kind of looked over at my diet to see what I'm eating. Is there anything contributing? Well, this kind of continued, and when I went up a pant size, then I thought, gosh, what in the world could be going on? Must be my thyroid, something going on there. Never, never, never did I think anything of a tumor, and certainly not cancer. We were snowbirds. We live in Florida right now, and we were snowbirding down here from Minnesota. And I didn't have any doctors down here because when you're only here, 5 to 6 months, you just are not able to get doctors. And I was on my way back to Minnesota and was scheduled for my annual pap smear. And I thought, well, I'll just talk to the doctor and see what she thinks. Well, she couldn't get the speculum in. And as she palpated vaginally and on the outside of my abdomen, she could feel a mass. So the next day I had a ultrasound and CAT scan. On Monday, that was on a Friday, on Monday I had an MRI. And on Tuesday, I was in the GYN oncologist's office telling me I had a very massive tumor and it needed to be taken out now.
Wow.
So, yeah, it was a whirlwind from a Thursday to a Tuesday.
Now,
and,
Karen, well, I just wanted to chime in here really quickly because I know you're going to be breaking this down a little bit more when it comes to ovarian cancer and symptoms. But so were these late symptoms that you were experiencing? Late symptoms, or is this were these early symptoms? I guess you'll explain further about how this progresses,
right,
how quickly this can progress. But I just wanted to ask you personally if these were early or late symptoms for you.
You know what?
The bloating.
They fit both categories. The bloating fits both categories of early and late. And what they're finding with ovarian cancer, whether it's epithelial or clear cell, or I had a sarcoma, some women will have no symptoms, none, and they may go in just for the annual pap smear like I did, or just go to the doctor saying, I'm having a lot of indigestion, which is a common symptom, or I feel full, I hardly eat anything, and I'm full right away. So, and then when the doctor opens them up, they could be a stage 3 or 4. And so it's both an early symptom and a late symptom, if that makes any sense to listeners. Mine being a sarcoma, it was an early symptom because sarcomas are so aggressive. And I'm just very fortunate that I went in for my pap smear and it was found that way rather than me going to internal medicine or general practitioners. Nothing against them, but they maybe would think first maybe of other things rather than ovarian cancer or think of a tumor. So there are several symptoms that most women complain about, abdominal or pelvic pain. I had none of that. So between bloating and pelvic pain, those are the most common symptoms I hear women say. The other one that I hear so frequently is the feeling of being full quickly or indigestion, increased gas. Well, the problem with those symptoms, what are the doctors usually going to think? They're going to think colitis. They're going to think something with the GI or the digestive symptoms or system. So there you go with the big problem with ovarian cancer right there.
Well, Karen, this is Keith. When you and I spoke on the phone some time ago, my wife was reading the book, sitting there crying, and I read the book not long after, and we lost a very, very dear friend, my wife's very best friend, to ovarian cancer. She had low back pain, bloating, feelings of fullness, etc. She saw a doctor, she saw a naturopath, she saw a chiropractor. No one ever mentioned the possibility of ovarian cancer because it's not on people's radar. And luckily, you went, well, people have to read the book to really hear the entire story of what you went through, but you ended up getting it detected, getting it treated. You're now a 5-year survivor. Thank God. I'm so glad and so happy for you, and happy that you can now educate women and men about these symptoms. So are there specific risk factors that women should really watch for, and men who love women? What are the risk factors that might predispose one to ovarian cancer?
There are some definite ones. However, this is the mystery of ovarian cancer. It's a very unique cancer, is that you can get it without any family history. However, usually we look for people with ovarian, breast, uterine, colon, or even if there's males in your family line that have had prostate cancer. But I had one aunt who had breast cancer. That is it. The other risk factors is it does increase in incidence as you age. So I was 68, as I say, so that was certainly a factor. If you are of Eastern European Jewish heritage called Ashkenazi, those ladies unfortunately also are at far greater risk because of the BRCA1 and 2. It's more common in that culture than other cultures. The other thing that tends to be a risk factor is if the woman has never been pregnant. When now this is an interesting fact, is that if the woman has been on birth control pills for 5 years minimum, the longer she's been on them, the better for this. it reduces the risk of ovarian cancer by 50%. They don't fully understand why, except from readings I've done in the last couple of years, is that the more often a woman ovulates, the more difficult and stress on the ovaries and the lining of the ovaries. And they're becoming more and more suspicious that there's something in that connection. Fewer American and even some European, but American women, fewer nurse their children. So as long as you're nursing, or the more children you have, the less ovulation. So that's where they think with the birth control pills, that's the factor of why there's a reduced incidence.
Okay, so ovulating less frequently decreases the risk, right? That's one takeaway.
That's the theory right now. And part of the theory of the origin of ovarian cancer is not so much in ovary as the area between the fallopian tube and the ovary where the egg comes out. This is the current suspicion, is that is actually the area where the cancer begins, if it's going to begin. So once again, that kind of plays in with the theory about the fewer times the woman ovulates, that decreases her risk.
I just wanted to chime in here, Karen, to say that I appreciate this information because in my private practice I have quite a few females, and there are quite a few discussions about the ovulation and menses and whether to have someone on birth control pretty much nonstop or to not have any breakthrough, just to continue having the, as we say, the active pill. And I'm personally going to follow up on this to do some more research about this, because we do discuss this with gynecologists and women's health practitioners in a lot of our meetings about some of our patients. And so I appreciate knowing that tonight. So thank you for actually informing me.
And I appreciate all that anyone, whether they're in the nursing field or not, anyone that can keep asking the questions, but also keep the information out there. Women and men need to know their bodies. And I'm guilty. I just assumed incorrectly it was postmenopausal. And if I'd possibly, if I had been in Minnesota where I have my physicians, I possibly would have gone in sooner and said, hey, what do you, I did have thyroid problems when I was a teenager. Is this something cropping up again? What's going on? Now, maybe it would not have made any difference, and it's a moot point. But the point I want to make is that women really need to realize that if they're having a different discharge from the vagina, if their menstrual periods are changing, change in how their bowel movements, are they urinating more often than normal? Now, I know all of these symptoms are so similar to all kinds of different health issues, but if we look at our family history, if we look at what our symptoms are, and I sent some symptom diary cards, and the recommendation now is that if the woman, let's just use the one of pelvic pain, because that's a pretty common one. She wakes up, she's got some pain down in the abdominal or pelvic area. Write it down on a sheet of paper or on your calendar and rate the pain. And then what did you do about it? Did I take Tylenol? Did I take ibuprofen? Did I put an ice pack on? What did I do? And what were the results of that? Did it improve? Did it get worse? Did it remain the same? And repeat doing that, keeping track of what's going on with that pelvic pain for 2 weeks. And if that pain is either still there or has increased, go see. Now, this is my personal opinion, but it's also the opinion of several oncologists in the Orlando, Lake County area that I've talked to. You must go see your GYN doctor, because GYN doctors are more likely to say, let's screen you with the CA-125, which is a blood test. Let's get an ultrasound, and let's just make sure what's going on there. So that's the recommendation, 2 weeks, and just to keep track of any differences that's going on. It may
Karen,
make a difference.
Well, I was going to say, Karen, this is a wealth of information, and it just seems so simple for me as a nurse to do something like this, to help my patient, just to educate them for the next 2 weeks. This is fantastic.
Well, good. I'm glad this is helpful. I wish I had known this 5 years ago, but
sure.
That's okay.
Well,
there's a reason for everything.
Well, so Karen, so me being a nurse, my role as a nurse, you're talking, I know we wanted to talk about nurses listening, not just hearing, but throughout this process, what else would be the role of the nurse in all of this? Because I know we wanted to discuss that as well. Right.
Well, let me answer it this way. When I think I even wrote an article or a blog about being on the other side of the stethoscope, or being now the patient rather than the nurse giving care. And it was kind of not a double-edged sword, but on one hand, I knew what to expect. I knew to tell the nurse my pain was edified, it was creeping up. I knew the importance of walking and moving around and deep breathing and all the typical things post-surgical. But I also didn't want the staff to assume I knew everything. And so that's where I'd say it's kind of a double-edged sword. So it's important, if you're the nurse in the hospital with a patient, even though you know they might be a physician or a nurse, not to assume they know everything, but also they just may want that conversation of, okay, where's your pain level? It's a 5. All right, how about if we give you some Dilaudid or whatever? Make it a conversation so that the patient feels like they truly are part of the discussion and have some control over what's happening to their body. I also have, having been a nurse, and I'm speaking from the hospital point, and I'll get to the clinical side of it too, but I know nurses talk about their patients. And they can be out at the nurse's station saying, oh, Mrs. So-and-so in room 204, oh, she's hard to talk to, she's always grumpy, or whatever it might be. Or Mrs. Jones in room 208, what a delight, I can't wait to be back in her room. Well, voices carry down the hall. And so my message is, make sure the door is closed before you start talking about patients with other nurses, unless it's a clinical thing that you're going to go on break and the nurse needs to know Miss Jones in room 208 was showing a little sign of a fever. Would you keep an eye on her? Or whatever, but not to talk about the character, personality, and so forth of the patient. I also, as a nurse, I know how busy nurses are. And I would be reluctant to call the nurse to come and help me because I knew she was busy. But my lesson was, I had to remain a patient and not be a caretaker of the nurse. It's, you know, if I needed help, I needed to ask for it. When it comes to whether it's hospital or clinic or chemotherapy nurses, my belief and experience as a nurse as well as a patient is how incredibly important it is for the nurse to be truly attentive to the patient. Make that patient feel like she or he is the most important person at that moment in that nurse's life. Listen to what they're really saying, and attentive listening. Watch the patient's body language. Watch their eye contact. My chemotherapy nurses were, well, actually, every nurse, I didn't have one nurse I didn't love and like, from the hospital all the way through chemotherapy in the clinic. They've all been just tremendously wonderful, really and truly. I didn't have one, what was her name, Nurse Thatcher, from One Flew Over the Cuckoo's Nest. I didn't
Nurse
have one
Ratchet.
of those.
Right. Good thing.
I didn't have one. So anyway, good listening, and I'm a big, big believer in touch. And obviously I mean healthy touch, loving touch. A lot can be gained by just a hand on the shoulder or a hand on the hand of the patient. And some people do want the hug. And at one point in the hospital, I think it was about my 4th or 5th night out of 7, I just felt I needed to really kind of talk because I was feeling really fearful. And the nurse came in to give me my meds for bedtime. And I said, you know, I know you're busy, but could you just, and I patted the bed, and I said, could you just sit here for a minute? I just need to talk for just a minute. I won't keep you. And she sat down, and I put my hand on hers, and then she put her other hand on top of mine. And I just started to not cry, but tears flowed, and I just shared a few things that I was feeling fearful about. And she listened, and then she responded and said reassuring things. And I don't think that whole process was more than 5, maybe 10 minutes at the most. It was very short, and that's all I needed. So the power of touch, I think all of you and your listeners are aware of, you know, the biochemical things on in the body and the release of the endorphins. And so when all of that is happening, all the good physical things in the body can happen, and emotionally, mentally, the patient is better. And I believe spiritually, the patient is better. So those are things that I convey to the nurses that are listening. Is, again, I know you're busy because I've been down that road, but just try to. You might find actually you'll be less busy. Maybe that call button won't ring quite as often if you take the few minutes extra to look in the patient's eyes and listen, and maybe just a hand on the shoulder or the arm or something. So
that is so wonderful, Karen, and I think a lot of us nurses need these reminders from time to time, and it would be nice to get them from our supervisors and managers, but those supervisors and managers are also often stretched to the limit as well. So we have to remind each other and ourselves that we have to take that time. And coming from you as a retired nurse, you know what you're talking about, like you said, because you've been there before. And I just want to ask you another question about that reversal of roles, if you will. So for you being on, let's say, it might sound like a cliche, but being on the other side of the stethoscope, I know that can be very difficult for some nurses. Like you said, you were trying to be a caregiver when you really needed care. So what would you say to a woman, especially a nurse, who ends up in your position? How do you let go and decide, I'm going to be a patient right now and ask for what I want? What happens internally that you can flick that switch and ask for help?
Well, that's a very difficult one because we nurses are so busy taking care of everybody else. It's hard for us to let go of that. It's very difficult. And I think because of the seriousness of my illness and being told I had only 50% chance of surviving 5 years, my mortality was right there in front of my face, and it all hit so hard and fast and furious. It's not like a slow development, like, I think I've got some early signs of cancer, like Uncle Joe had, and you can kind of prepare yourself. It was, and this is typical again of ovarian cancer, is how that is. So, I guess what I did was I had to search into myself what I needed and how was I going to handle this, and I like the word challenge rather than problem. How was I going to handle this challenge? How was I going to face it? So now these are my mechanisms, and one of them is meditating, going into a very deep, relaxed state, and in my belief system, letting God, not letting God speak to me. God speaks to me, but I just am usually too busy talking to Him or not fully listening. So for me, when I do deep meditation, I hear and I can listen to God. Along with that is just taking steps of recognizing when I'm allowing myself to get too tense and too fearful, too angry, and just even doing something simple like making sure I'm breathing from the abdomen and just letting go. It's not time to be thinking about that right now, Karen. What you need to do is think about the food that's in front of you that the nurse just brought in and eat as much as you can because it's good for you. Or despite the pain and everything, you need to get up. So knowing what I needed to do to make myself better. I'm also a person, and we've been very serious this evening, which is fine. That's fine. But I do use a lot of humor in my life. I always have. So for me to be able to laugh or to smile is very, very important for me. So those, again, are things that I would encourage the nurse who's now a patient, is know what is good for her or him in facing this new challenge. What is a healthy way? How have they dealt with things in a healthy way before? And I think once you let go of your fears and know what path you're going to try to walk, you're the one in control, and then it's easier for you to accept caregiving. And we can talk about the difference of caregiving and caretaking if you'd like, because there is a difference. Then you can be a better patient. So that's I mean, it's a difficult question because it's a very individual situation. But that would be my answer for you.
Well, and Karen, the challenges that you talk about, for a patient who is faced with this challenge, they are, maybe it's a patient who, previous to this diagnosis or this challenge in their lives, they might not necessarily be open to touch or talking about things. But it seems as if I'm not saying that that's how you were pre-diagnosis, but generally I do work with patients who aren't so huggy-feely or open to communicate. And it's interesting to see that evolution occur within them as they try to focus on the immediate to just get through it. And then many of them continue to embrace that lifestyle as part of that evolutionary process within their hearts and their minds to continue to survive that and deal with the post-traumatic situations of getting through that dire situation, the treatments, the therapies, and all of the clinical and even the integrative medicine that we talk about here on RNFM radio. But then some patients just continue to carry that on for years and years or for the rest of their lives, is make that part of their existence now, post-challenge or post-diagnosis. So would you say that is the case, personally for you and for many others?
Yes. And well, as you learn in my book, my parents were alcoholic, and there was sexual and physical abuse going on. And from my grandmother, who didn't know about all these things, she was my role model. And, for some reason, I liked her attitude, and I wanted to embrace her attitude. So she taught me, directly and indirectly, so many things that I have adapted throughout my life, facing divorce and untimely deaths and different things, and certainly the cancer, of what is healthy and right for me. And speaking of touch, because of the sexual and physical abuse, I didn't like being touched, especially if he was a man. I would just pull my arms across my chest, and I was just rigid. I wanted nothing to do with it. I was fearful. But I gradually learned, again, I can't name every single event that helped me to understand that, touch is our first sense. It's the one sense that affects all the other senses. Our skin is our largest organ. So just from a clinical standpoint, but then when you think in the womb, it's the amniotic fluid that is touching us. So, touch, again, obviously we're talking about healthy, loving touch. It is and should be the norm. And when I was working with clients in my service, Kare N Touch, there were several that came to me because they had been sexually abused. And they were married, but they weren't comfortable with sex. They weren't comfortable with their spouse hugging them, touching them, kissing them. They all were able to release their fears about touch and that it could be trusted. Certainly there are people you can't trust, and you learn to sense those people. And they healed themselves, and they forgave their perpetrators. And we have to forgive our perpetrators. If we don't, we carry that burden with us all through our life, and then that gets spills onto people that are our children or our spouses, and this cycle continues. So forgiveness is a key, and acceptance that there is good, healthy touch. And so I believe that if a nurse goes into a patient's room or sees them at the clinic and just gently touches them softly on the hand and says, "How are you?" probably 99% of them are not going to pull their hand away. Just my opinion.
Right.
And it's just a first step.
Well, this is great, and that's a great first step, and I also love that power of forgiveness because I know it can be difficult, but it is good to hear you say that that's certainly something that we have to come to terms with, and we do have to forgive. But Karen, what I wanted to do too is if you wouldn't mind doing us a favor, especially for the listeners out there, because we really like to break things down even further and define them. Could you allow us the opportunity to give your perspective on caretaking versus caregiving?
I'd be glad to. For me, caregiving is only with another human being. You don't give care to a dog, or you don't give care to a inanimate object. You take care of your dog or cat. You take care of the inanimate object, your car, your house, your lawn, and so forth. And giving care, caregiving, always involves love. You do it out of kindness and love. If you're doing it out of your own selfish needs or your disregard for the patient's needs, then you are taking care of that patient or that person. A prime example is, if I can think of something, well, my husband's probably tired of me telling this story, but it's a good illustration.
Well, is your husband listening? Because I haven't heard the story, and I don't think our listeners have. So, if he wouldn't mind, I would love to hear this story.
Okay,
yes,
he won't
please.
mind. It's not even. I think it is in my. You are going to be familiar with this, but my dear husband so kindly always came to the hospital right away, 7 a.m. in the morning, and would sit with me till 8, 9 o'clock at night. And everybody knows there's nothing more tiring than sitting in a hospital room. It's just exhausting. And one evening, maybe the third or fourth night I was there, I just looked in those big blue eyes and I just said, honey, it's 7 o'clock. Go home, get some dinner, go to bed, rest. I'm fine. No, I don't want to leave you. I'm here if you need me. I said, no, you know what? I just want to go to sleep. I just want to be alone. I'm fine. You go home. So reluctantly, he left. And, maybe a half hour, 45 minutes later, I'm just starting to drift off to sleep, and I can sense a presence in my room. And I opened my eyes, and the room was kind of dark, and I couldn't imagine who was there. And I said, I'm sorry, can I help you? Well, it turns out it was my daughter-in-law. And my husband, Jim, had called her and said, would you go over and sit with Karen? I don't want her to be alone. And I said, Robin, I'm fine, hon. You go on home to your family. I'm fine. I'm just going to roll over on my side and go to sleep, so you go on home. I'm fine. So the next day, Jim and I talked about it. And I am the kind of person, even if I feel like I'm coming down with a cold, I like to just go and lay on the couch or on the bed, curl up with a book and some hot tea and lemon, and just let me be. My husband wants me to be very attentive to him. When he was in the hospital for a week for a colon resection, he wanted me there at 6:37 in the morning and not leave till he was sound asleep at 9:30 or 10 or whatever. He wanted me to be the one, helping him shower, his meals, calling the nurse, doing whatever he needs, and it's fine. He needs lots of attention like that. So he was caretaking because he was putting his needs of what he likes on me that particular night. So that's how I define the difference, because everybody is different. And so it's knowing what do they need and what do they like, rather than what do I want to give them, what do I think they would want. So those are my definitions.
That's very helpful, Karen. Thank you for sharing that, and thank you to your husband from us for allowing you to tell the story again. That's good for people to hear, because that's a nice illustration, and it's very giving of him to allow you to share that in public. So we appreciate that.
Yeah.
Now, I didn't prompt you again about this when we were talking before we came on the air, but is there a brief passage you would like to read for us and our listeners?
Well, I would love to. You didn't have to prompt me. I do presentations about ovarian cancer. There's one of two that I always read. And this one, because we're being so specific about ovarian cancer, this is by an unknown author. It's called What Cancer Cannot Do. What cancer cannot do, it cannot invade the soul. It cannot suppress memories. It cannot kill friendship. It cannot destroy peace. It cannot conquer the spirit. It cannot shatter hope. It cannot cripple love. It cannot corrode faith. It cannot steal eternal life. And it cannot silence courage. And that's it.
Thank you. And is that in your book, my dear?
It is. It is. And again, just to say one more time, to the proceeds from the book go to ovarian cancer research at one of two places, Mayo Clinic in Rochester, Minnesota, and to the Florida Cancer Institute. And it's for GYN cancers. It's not for other cancers. There's so little for it, and that's where the money goes. Little bit that I donate.
Well, that's a beautiful poem, Karen. And remind me, you wrote that poem during your after your diagnosis?
I didn't write the poem.
Oh, right. You didn't write this poem.
No, the author is unknown.
Oh, the author was unknown. That's right.
Yeah.
Now, do you have a little something from Outshine of yours that you'd like to read, a little passage as well?
Well, you kind of caught me off guard.
Oh, my gosh. Well,
Good
that
going.
Thought for a second. Right. Oh, sorry.
Yeah.
No. Go ahead.
No, go ahead, Karen. I'm sorry. No. I wanted to do is talk about because you wrote the book, but then you also blog as well. Is that correct?
And I often have guest bloggers. So anything about health and wellness, relationships, spirituality, and of course cancer. I recently had a blog about mesothelioma. I have one coming up about faith and healing. It's a variety of subjects, but always surrounded with in those areas. And I always insist, whether I'm the one writing them or a guest blogger, that they are positive, that they are informational, and that they are inspirational.
So, Karen, just to elaborate more about this, so those that are contributing authors to the site, are these survivors, or these individuals who have faced these challenges?
I have had a woman who's a breast cancer survivor. She's from South Africa, and hers was wonderful. It was called, I think, God's Medicine Cabinet. I think that's what it was called. It was wonderful, and it was well received. I've had Charlotte Holt I don't know if you're familiar with her. Of course, I'm not thinking of others. There was a woman from India who did one. Her name is Madhavi Sood, and hers was all about her near-death experience. Actually, experiences, I think it was 3 or 4 times that she came back. And it was all done, she expresses herself all through poetry, which is wonderful.
Mm. Well, yeah, good. And again, it's great to have a platform available for those who have faced the challenges and, of course, those who want to know more about it. And again, Karen, I have to say, I just tweeted out that this evening, because for me, women's health has, as of late, in the last couple of years in my career as a nurse, it's been something that I have said to myself, especially, maybe it has to do with having a wife and I care for her so much, and then, of course, the complexity of women and wanting to understand that aspect. And I just want to say thank you personally as a clinician, but also as a husband, for educating me even further when it comes to women's health issues. Like I said earlier when you talked about the logging the pain and what they're doing for that. And then, of course, again, I'm going to look into further research about ovulation and menses and of course, using the pill and breastfeeding and really equipping myself with those resources so that I can advocate for my female patients, even more so than I am now. And I just want to personally take this opportunity to thank you on the air.
Well, and I thank you also incredibly for this opportunity. And you've said this several times, and I hope I have too. It's equally important for the woman, but it's equally important for the man as it is for the woman to be aware of these symptoms, and for the man to know the woman's health history and her family history of health. It's very often the woman might rationalize, I'm 34 years old, of course I'm going to have menstrual irregularities, or I might have this funny discharge, or I might have this pain because maybe I'm ovulating. But you don't ovulate for 2 weeks, You don't have that pain, or you shouldn't be having ovulation pain for 2 weeks. And it should be reduced by taking Motrin or some kind of an ibuprofen or Tylenol. So for the man to say, you know what, hon, let's just go see Dr. So-and-so. Let's just talk about it. Let's just see. Because, your mom had breast cancer or your aunt had this. And even if there isn't that family history again, which the doctors all feel mine was basically zero, it is important that it's the team that's going to find out what is wrong. And sometimes the woman has to be assertive with physicians and say, look at my family history and look at what's happening. Fine, we'll do a GI series, but I also want a transvaginal ultrasound. Let's just rule this out right now. Because GI problems are much more curable and treatable than cancers of any type of the GYN. I mean, there are some that are more curable than others. Certainly ovarian is the least curable. So.
Sure. Well, Karen, it's so true that men need to be brought in on this, just like it's important for women to be aware of prostate issues so that they can advise and encourage and maybe even cajole the men in their lives to get checked when it's necessary, and also to have the proper screenings done as they should be done on a regular basis for prostate cancer, even though there are some there's some controversies out there about whether it's even worth checking a PSA on a regular basis. But that's another conversation when we talk about men's health. But in terms of women's health, it is important for us men to really be aware of this, keep it front and center, breast cancer, ovarian cancer, etc., uterine cancer so that we can be supportive of our women and the women in our lives, but also to notice the symptoms ourselves, because oftentimes the person experiencing the symptoms may be in denial or may just be too busy to really pay attention. Oh, I've been bleeding for 3 weeks, but it's just an irregularity. I don't need to get it checked out. And you're right. The man can step in and say, wait a second, or the woman who's the partner of the woman can say, wait a second, let's step back here and take a little bit more of a proactive role. And now, I know we're coming to the top of the hour. You're on the East Coast. Kevin and I are back in Mountain Time, so we want to respect your bedtime as well. But I want to ask you about survivorship and remission. What really, how do you view remission? How do you view survivorship? And how do you view the notion of a cure? How do you see it? How do you cope with it on a day-to-day basis?
Well, that was several questions in one. I was determined by the doctor that I had started remission when I finished my last round of chemotherapy, and my PET scan showed nothing unusual or abnormal, and the blood test, the CA-125, which is our protein marker that will increase if there's cancer cells. It's a very, very unreliable test, but it's all we have right now. And it's unreliable because it has a lot of false positives, and you can have an elevated CA-125 if you are pregnant or if you have inflammation going on. You know, maybe you've got a sinus infection, or you're just getting over the flu or coming down with cold or whatever. So it's not a reliable thing. But since my CA-125 normal is 0 to 35, it had dropped down into the single digits. By the time I finished chemotherapy and my PET scan was normal, I had no symptoms. The doctor could not palpate or feel anything. So that is the day that I started being in remission. I am still in remission. I have had no recurrences, which the longer you go without a recurrence, the better, obviously. But, and usually the 5-year mark is the magical number. But a recurrence can occur any time. Oncologists that I have talked to here and even in Minnesota about ovarian cancer, the word cure is just not part of the language. I consider myself, quote, cured in the sense that I'm in remission. The cancer may well never, never, never come back, but there's also a chance that it might. It's kind of like a person who's had a heart attack. They are over their heart attack. They're in remission in so many words. They're not cured, even if they have stents and valve replacements and everything. Could the heart attack occur again? So it's kind of an analogy in that sense. I, again, cope with it the same as I do and have with everything. My belief in God, my using meditation, my humor, looking at things positively, just so many different things that I try to do in healthy ways helps me to live each day fully, fully, fully. I personally believe that I am here and have been spared, and my purpose in life now is to do everything I possibly can to get the word out about ovarian cancer. If I, as a registered nurse, didn't recognize my own symptoms, how can I possibly expect a lay person to recognize them? Not very likely. And there's not a lot out there about ovarian cancer. this is a discussion that some of us are having, is why don't we as a society talk more, woman to woman, even woman to husband, even woman to doctor, about what is going on with their GYN. I mean, we'll talk about, I'm scheduled for my mammogram, or I think I feel a lump, or we're willing to check our breasts. But there's something about the GYN department that I don't know if it's denial, if it's... I don't know what the answer is, but I think once we find that answer, that will help, that there will be more discussion, more awareness. So how I cope with where I am right now today, that's the way I cope, knowing I have this mission, and however long I'm on this earth to do it, I will do it. And, we're all mortals, so I do pay very close attention to my body. We had a little scare a few weeks ago, and I got a little scared that maybe something was starting, but turns out it wasn't anything after all. But I'm very proactive and very conscientious about what my body is doing. And even though I can now see the oncologist every year because I am at the 5-year mark, I choose to go see them every 6 months to continue that, and they're fine with that. The doctors say, that's fine, Karen, don't worry about it. So that's how I cope, is kind of living my life as I always have.
Well, Karen, we're so happy to hear that you have reached this point facing this challenge personally, and we encourage each and every woman out there dealing with the same challenges that to keep moving in that direction and finding something that they can embrace so that they can also be a survivor. Now, Karen, we do want to take this opportunity as we do come to the top of the hour, because this is your show. We're just the platform here, and we want to allow the opportunity for all of our listeners who are not hanging out on Twitter or our Facebook page or in our chat right now, where can they find more about you? Where should we send them to? We have been tweeting out your website, and that would be Outshine, ovariancancer.com. Is that where you'd like us to send them to find out more about you?
Yep, that's probably the best starting point, is that to stay with what I am doing on a daily basis, probably my Facebook page. And I know, Keith, we talked about maybe finding a shorter URL, but that Facebook information is on my website too, so that would be available.
Well, great. Well, what we'll do, Karen, is, so for all the listeners out there that are not near a computer at the moment, you can go to www.outshineovariancancer.com to find out more. Now, her Facebook page, I won't give you that link on the air because, again, there's a couple of numbers after that. But here's what we will do for you, Karen. Of course, as always, for the listeners, we will post all of that information not only on Twitter but on Facebook. And along with that, because I believe, didn't you want to add in this evening a giveaway for one of your books, Outshine, an Ovarian Cancer Memoir? Okay. What we plan on doing, Karen, is we will post all of that information on our Facebook page, and we will allow our listeners the opportunity to check out your website, go like your Facebook page, and we do encourage you to like Karen. Of course, I know you like Karen, but you got to head over to Facebook, her Facebook page, and like her page over there, and of course follow her on Twitter at Karen Ingalls 1, and we are tweeting all that out. Again, all of the information will be on the Facebook page, the link to her book, of course, and everything, and we encourage our listeners, so as soon as you've listened to this show, please head on over to Facebook, to the RNFM Radio Facebook page, and comment, like, add feedback, whatever you want on Facebook. Just let us know that you heard the show and that you've seen the post on Facebook. And what Keith and I will then do is do a random drawing to then give away your book, Karen. And we have a show coming up this Wednesday, so just in a couple of days, and we will announce that live on air on Wednesday. What is that, October 9th. And then we will, of course, let you know who the winner is, and then we will get that book to one of our community members out there. How does that sound?
Okay, that sounds terrific. And if anyone wants to follow me on my blogs, it's outshineovariancancer.blogspot.com. I would welcome new people, and if anyone wants to be a guest blogger, if there's someone named Kevin or Keith that would like to do it sometime, I would love to have one or both of you.
Oh, well, thank you. Thank you, Karen. And we'd also like you to write a post for our blog as well. So I just sent you an email to remind you to call me about your Facebook account, and we'll fix that up for you. And we'll also talk about having you on the as a guest blogger for us as well.
That would be wonderful. I'd love to do that. And again, thank you so much for this opportunity, because there's so much need out there to get the word out about ovarian cancer. And I know there's a lot of different illnesses and diseases we all need to be more aware of. So thank you so much. I appreciate it.
Thank you, Karen. The pleasure is ours.
Yes. Have a wonderful night, Karen.
Okay. Thanks a lot, guys.
Okay.
Bye-bye.
Good night.
Good night, Karen. Well, Keith, it's interesting. I was going to say, because sometimes I just feel like we're just a couple of dudes here hanging out on air, and we're talking about women's health issues. But I do want to say that I, for one, I want to second what I just said. I'm going to second myself that I just appreciate Karen offering that information to me, again, as a clinician. I learned valuable information tonight, and I hope other nurses did as well. And I am going to apply this in my own practice starting right now.
I'm sure you will, Kevin, and I'm sure you will also apply it, as I will, in our lives in terms of the women who we love and care about and know everywhere, in all aspects of our lives, not just our family members, but our friends, our patients, our clients, our colleagues, our neighbors. So this is really something to help educate people about, and as men, take responsibility for alerting women and being aware when women speak of symptoms that we know could speak of underlying ovarian cancer or other GYN cancers.
Right, exactly, Keith, exactly. You've hit the nail on the head, and again, I'm just glad that we had Karen on, and we know, we assume that the females on board with this, the women in our lives and as clinicians, those that we know, our colleagues, are in tuned even more so. But again, we also want to extend that statement, that offer to the gentlemen on within our community at RNFM Radio, and as nurses, clinicians, whatever your background, whatever services that you provide, whatever healthcare provider and title that you have, please do take an opportunity to embrace what Karen has to say, and again, apply it into your own practice as a clinician.
Right. Yeah, and I think what we'll do is throw together a little blog post on rnfmradio.com with some of these wonderful links that Karen provided to us that we've been tweeting out. But some people aren't on Twitter, or they might not be able to find the link. So we'll put it all together in an easy-to-find little ovarian cancer guide that we can post on RNFM Radio. So we'll do that in short order, hopefully this week. And I wanted to make sure our listeners know again to go to outshineovariancancer.com. That's where you can read a sample chapter of the book and purchase the book, of course. And you can also go to outshineovariancancer.blogspot.com to find her and follow Karen Ingalls. That's with a double L, Ingalls, 1 on Twitter. So you can find her there. We'll make sure we get her Facebook page out. And we want to give away a copy of the book. So look on RNFM Radio's Facebook page starting later tonight, and you can hopefully, possibly win a copy of the book. Now, Kevin, we do need to move along and wrap this up, but we need to talk a little bit about the NNBA conference in Orlando and about our upcoming show on Wednesday afternoon, where we're really going to be wrapping up and debriefing our experience in Orlando. So what would you say about the weekend we just completed just a few hours ago?
Well, I think one takeaway, there are so many takeaways, but one of them, I would say, I was thinking about this in the car on the way home to the studio here this evening when just thinking about the show tonight, is that there are some really smart, savvy, and caring nurses out there that want to help each other. And we talk about it on RNFM radio all the time, about ourselves, but also the guests that are on the show, to actually meet them in the flesh and really see the passion that they have, that they want to help, they want to inspire, they want to invoke that spark and have the ability to get the nurse to take that spark and nurture that, give it oxygen, whatever that it needs, to become like I don't want to say a full-blown fire, but really to execute on their ideas. I mean, it is amazing, and I wish, and I'm sorry, actually. First, I'm sorry that there are so many of you out there that didn't have the opportunity to be there at the NNBA with us all this weekend. And I know that life does get in the way, and maybe you couldn't make it, or finances, or what have you. But what I can say is that it was so sincere, and everybody just opened up. It was so transparent, and each and every person there, all the speakers and the presenters, and even those who were just there to participate, they want to help each other. And I really felt that it was so genuine.
It really was, Kevin. I'm glad you said that. And what I was telling my wife, Mary, over dinner tonight is that it did feel so sincere, and one of the most wonderful and powerful things about it, aside from the wonderfulness of Pat Bemis, who's the president of the NNBA and a wonderful person and puts together a great conference, and we had some really great speakers, was just being together. And for RNFM Radio, it was like a family reunion. We had Renee Thompson, Nurse Friendly. We had Michelle Podlesny, Erica Leach. We had all these people who were alums or alumna of RNFM Radio all in the same room together. And then we met other new friends and invited them to be on the show. And we talked to people in the flesh and hugged them and shook their hands who we've known on social media for a long time but never really met in person. And just all being together in what I guess the word I would use would be synergy. The synergy that happens when we're all together in person was really palpable. And I told my wife, Mary, that I've come home fired up. I've come fired up about a lot of my colleagues out there, but also about my own business and what I want to do. And I'm very inspired by so many of the people who were at that conference and what they're doing in their lives. And it feels like a huge family and support group. It's almost like a huge support group, but we're also like family. And it was really a powerful experience on that level.
I think it really gave empowerment a shot in the arm, so to speak. All of us there under one roof. Like I said, so many brilliant minds and innovators that we all came together and we energized each other. Like right. I was like jumping out of my skin at points, like thinking like, my gosh, just the sheer power of what this woman was saying. I mean, and just fill in the blank, or this gentleman was saying that. It inspired me as well. And not only that, so, Keith, it's inspired us to certainly branch out and take on new business partners, but also, I would say, and we're going to talk about this on Wednesday, I think you and I have some very, very dear friends out there now. We had friends virtually, yes, but I think now we have some very dear friends that I hope to stay in touch with for the rest of my life.
Oh, I hope so too, Kevin. And Renee Thompson went to bed. She's out in Detroit, so she's not listening now. And Andrew Lopez may still be listening. I'm not sure. But you can go to our Facebook page, see a picture of Kevin in a sombrero sitting in a Mexican restaurant with me and Renee. And there will be some other photos soon. I hope Andrew will be posting those soon so that we can get them out to our community. But you can see us all together. And yes, we really solidified some really wonderful friendships out there, and friendships that are really going to grow and blossom over time. So we're going to talk about this more on Wednesday at 3 p.m. Eastern. We hope a lot of people will listen in, either live or otherwise. We're going to try to get some of the people who were at the conference to call in on Wednesday, right, Kevin?
We are. So we will do a shout-out to our new social media savvy nurses out there that we helped you. We educated you and hopefully gave you a few little nuggets of information to get you started. So continue to follow that hashtag RNFM Radio, and it will be live. Of course, we use hashtag RNFM Radio quite often, pretty much daily. But on Wednesday, 3 p.m. Eastern Standard Time, we will be there live in the tweet chat, and we are following you. So hopefully you're looking at that timeline, and you can catch that hashtag out there. So we encourage you to definitely participate, because we really loved meeting you. And again, we're going to be talking about you, but it's all going to be good stuff. Don't worry about that.
That's right. That's right. And we do have some video interviews going up on our Facebook page and our YouTube channel. So if you go to facebook.com/RNFM Radio, you will find an interview with Rachel Cartwright, Renee Thompson, Pauline Sanders. There'll be more coming. Or just go to YouTube and type in RNFM Radio, and you will find them there. And there'll be more videos up quite soon, I hope. Right, Kevin? And again,
there will be.
Yes. Again, Wednesday the 9th, in 2 days, we will have a conference roundup and maybe start tweeting out some pictures and some other things from there. Maybe have Pat Bemis on the show to talk about the next NNBA in 2014. So that's Wednesday, this coming Wednesday, 3 p.m. Eastern. Now, next Monday at our regular time at 9 p.m. Eastern, Monday the 14th of October, Julianne Paradisi joins us again, nurse, artist, and writer. She'll be talking mostly about her writing, not her visual art this time, and her adventures of Nurse Nikki, which is a fictionalized account of a nurse's life, so real you won't believe it's fiction. That's the tagline. So join us for Julianne Paradisi. On the 21st, drumroll please, we will be having the nerdy nurse, Brittany Wilson, will be on the show with us on the 21st of October. We can't believe she's finally going to be with us. We'll be talking all things tech, and Kevin will just be beside himself. So we will do that on the 21st. And finally, on the 28th, at the end of October, Clinician Poet Roundtable. We will have 2 nurses and 1 doctor who are poets reading their poetry on the show. It's going to be a beautiful, really incredible show to round out the end of October. So this is going to be an incredible month, folks, and just wait. We have booked our friend Karen Appy from the NNBA for later in October. We've also booked our other friends, Olga Carmichael, Donna Cardillo, and Gary Brongo, all of whom we met at the NNBA in person. So, Kevin, there's amazing stuff coming up, so people definitely want to tune in.
Well, Keith, there's always amazing stuff coming up. I don't know how we top it, but we just do. It's just each and every person that we have on here is just amazing. So it just keeps coming, and quite frankly, it's because of you. I mean, not like us, like you. Well, it is probably because of you, Keith, but also it's because of the community out there. Those are the nurses that really make this channel, and we appreciate that. We really do, and we are so sincere. And of course, as always, it sounds like we're wrapping things up tonight, and I definitely need to go see my wife because I haven't even seen her. And, of course, my kids are dying to hang out with me. So coming back from Orlando, we haven't had a chance to hang out as a family. So, Of course, Keith, I guess we'll start wrapping this up. And do you have any last-minute comments there, sir, at all?
No, Kev. I'm just going to encourage people to visit the Outshine OvarianCancer.com website and check out the RNFM Radio Facebook page about getting a copy of the book for free. We'll have a little contest over the next 48 hours. And come see us again this Wednesday if you can at 3 p.m. Eastern. So sending my best from sunny Santa Fe. It's actually dark outside, but it's always sunny anyway. And Kevin, enjoy your reunion with your family, and I'll let you say goodnight and sign us off for the evening.
Sounds great. Well, we look forward to having you back here with us this Wednesday, October 9th, Wednesday, to talk about the NNBA 2013. We'll be hanging out on that hashtag as well, still to come. And, of course, as always, we want to thank you for spending your time with us here tonight on RNFM Radio, or whatever day you're hanging out with us archived. We hope that you in some way have felt uplifted, motivated, and ready for something that moves the needle for you. Innovate and create. Find passion in your life and your career each and every day. Care for yourself while caring for others, and we look forward to having you back here with us again on RNFM Radio.